Thank you all. All right. I wanted to start just with, I have an agenda that Lisa helped me produce and did a great job for us. And I'll pull that up in a little bit. But I kind of want to get some feedback from everybody on there after reading the initial draft and what that looks like. Are we moving towards the target, or are we kind of going in a different direction that we need to come back to? I would love to have a minute or two for people to share what they think. So we'll popcorn this. So go ahead and enter and speak if you have some ideas.
Can I just ask a clarifying question about moving towards the target? Does that mean opening up?
Yeah. That means being safe in our product and what we're doing, and then making sure that as we have that open, we have the things in place for the safety and security of the staff and the students and everybody.
I think, Dave, you're referring to the doc that you sent around earlier this week, right? As your sort of summary of some of the steps you're taking.
I'm sorry. Yes. Yep. I'm sorry. The doc was sent out, I think, on Tuesday, maybe Monday afternoon, to everyone to kind of take a look at the initial draft. Gary did a great job of helping me kind of read through some of the resources I sent last week to everyone and kind of come up with a document that we can start working off of.
I think it's headed in the right direction. I would say overall, I'd be a little concerned about spending all of the time on this plan without equally spending time on a distance learning solution, and make sure that's really solid also. Just with Seattle Public Schools and Highline District, I believe, starting in the fall with distance learning.
Kent, Auburn, North Shore also joined with the distance learning, 100%.
I think Federal Way in Auburn as well.
Yeah, that's true.
Okay, so as we're moving towards this, let's address that just a little bit. We had a meeting today for about 2 hours with the team that's putting together the actual schedule for the building, and also different plans for distance learning for a while and distance learning for a long period of time. So that group is working on that, and that will be shared with all of us at our next get together on what those next plans are. So obviously that's going to be dictated by maybe the state or the governor or something to that effect. But we're a unique place, and I think I shared that with everyone. We're as a member of the Washington Federation of Independent Schools and a private school. Mandates and things that come down from the state are guidelines for us to reopen, and different things that we have. Our representative that goes to those meetings with the state and the state superintendent from the Washington Federation of Independent Schools has sent out a note to all of us, all of our school leaders, and I send it to our board that yes, these things have happened, but this does not mean that it affects us, and we're getting clarification on that at this point. So we are in that position. One thing I do know is our group here, our parent advisory group, and what we produce is for our parents. Our parents are our kind of our district, or the people that we are responsible for. And so as we sent out that survey yesterday, we're getting to be about 83% of our parents are very confident or somewhat confident. And I'll send the link out that you can see when we're done with this this meeting. So that's what we want to get to with our parents and this group, share out to our parents what we're doing at this point. But yes, I do agree, contingency plans, and we have to have, that's what I'm saying. All these plans are important. I want to be here. This is what I want, but I only want to be here if it's going to be safe, and we can do what we can to make it the most safe that we can. And that's what this group, and that's what we're trying to accomplish through all those plans. So
Dave, did you say you had a meeting this morning with a team who is also working on the possibility of a distance learning, a full-time distance learning as well?
Right.
And what that would look like, and
right.
and as compared to last spring, or
at this point, we're working on all those plans to make sure that we have contingencies in place. But at this point, from our board and from our district, the representative that goes to the the Federation meetings at this point, we're moving forward to being with our size and where we are and our size of our building to kind of move forward to being on campus at this point.
And just things that have been going through my mind, you know, thinking about this. I mean, we are unique. We don't have 800 or 1,200 kids. However, any way we do this, we are going to be exceeding any group gathering guidelines from the state, is my assumption. So, you know, that just is, even though I was one of the moderately comfortable coming back, we're taking all the steps as far as I can see, but there's still, you know, we're still going to be over the state guidelines. So I don't know what that means. I don't know what that means. Do we know what any of the other private schools are thinking?
What specific guidelines are you speaking of?
Well, like gatherings of 10. I don't know, the phase 2 says don't limit your gatherings to 10 or something like that.
Right. So we've been looking at that phased approach as well. For example, next week we're having a small gathering outside in our parking lot with families for graduates, right? And so in that phases, it says the religious organizations can have services outside under 100, right? And so what we're planning is having those pieces put into place. And many of our schools that I've talked to are looking at what of our plans that we can do being in our unique situation, not only the size that we are, but the religious institution that we are and how we can do that safely as well. Now, Governor Inslee comes on and says, you know, now we're down to 5 or whatever because of the numbers and this and that. We do have to adjust according to that. Now, does that the clarification question I have about the gatherings is, does that mean our gym is a gathering spot and our upstairs is a gathering spot, or is it all one building in the same? Because the distance that we have between those are huge. So it's not like everybody's going to be in the gym. You know, it's going to be separate all the way through. And those are clarifying questions I have on the phased approach for us. So yeah, there's still some questions to be answered. This is our initial meeting. We want to just have some kind of a plan moving forward and then adjust our plan to the responses that I get back from people in the educational field, as well as people in the CDC and the other guidelines that are sent out.
So it seems like what you're looking from the parents on is, in the event that we do go back to school for the learning program, you know, what kind of a program would need to be in place where we would feel safe and good about having our students there, right? And we might you might make a decision to pivot, you know, based on all of the external information and data if you need to do a hybrid sort of a route.
Thank you. Thanks for summarizing that for sure. And then also help with, you know, with the legs of the plan, really, you know, talking about it to others, as well as formulating a solid goal for all of us to do. Glenn followed my email up with some ideas about cleaning and some ideas about getting things going for the building in August. And this group could help with that as well. So why don't I pull up the agenda? Let's do that. I'll share a screen and I'll go to desktop. Oh, let's see. Oh, of course, you're all over my, there, you move you over there. I'm getting okay at this, I think. Here we go. Maybe not. There we go. All right, are you able to see that?
Yes.
All right, perfect. So we went through the agenda number 1, really kind of the role of the advisory group. Everybody's, you know, thoughts and opinions, if you are very important. So if you can't share them right now, like Christina, who's driving, you process her information and share via email. That would be great as we go through this. Deadlines and deliverables is another idea that we had here for this group. I would like to come with a formula of our initial in-building process that we're going through now to get to our board in the next week and a half would be great for us. Meanwhile, we'll have another gathering where I'll send out information first, and then we'll gather again with the contingency plans that we talked about this morning in our meeting as well. So we'll have, and then that can be a subject of our next gathering as well as refining this. So does that kind of give everybody an idea? The next week and a half, I would say probably maybe by a week from today, the 30th would be a great time for us to kind of have a solid draft of this to send off. I mentioned the survey results. The survey results will come out via email to you after this meeting with some notes maybe from the meeting, as well as you can look at the surveys. The teacher surveys is not all complete yet, so I'll send that out following the completion of the teacher surveys as well. Any questions on those surveys and who they went to? All right. We kind of addressed number 4. That's the principles that we've sent out, headed in the right direction. And I think entry in the building was the first point. I do have a question about a couple of the items moving into entry of the building. The smell test. Is everybody aware of the smell test?
I'm aware of just, that's one of the senses that you can lose if you test positive, but I didn't know there was such a thing as a smell test.
Yeah, that was shared with me, I think by Lisa Britton, that says one of the things for young adults is the loss of smell is a high symptom. And so we're going to administer just a smell like a peppermint or a garlic or some kind of smell daily, and the students just tell us what they smell, basically. And in that process, that lets us know if there's a symptom there.
How do we, does everybody share like the same, I guess I'm just trying to think how that would work, where everybody would keep their noses 6 feet away from smelling something? Or maybe Lisa, you can give some input on that about how that works.
I haven't seen where any organizations are doing that. So yeah, that would be something that we have to, I guess, check out and see. I don't know if that would be something to do in the classroom, but I haven't seen where organizations are actually doing that. But I would say I have seen people, and that's their main symptom or only symptom is loss of smell or taste. So I think that's a good thing to look at for this, as part of the screening.
Yeah, and similar, Dave, I think just making sure that it's a standard test, like that it's not too ad-libbed, if there is sort of a test you can acquire that, is safe to use, it's a one-time use, or, to address, I think, Wendy's concern. I think, yeah, I would just be more comfortable it's a fairly established test with a clear signal. Otherwise, it probably, introduces more concerns than it solves if it's something we're sort of devising on our own.
Yeah.
But I think the one issue that came up was getting too close or sharing, but I think the person screening is probably going to be relatively close to the person that's being screened. And so if there is a way to do that, I think it could be done that way. And that's actually really a cool idea. I hadn't heard of that, but I know for when you have to wear a respirator, you get the first test is whether you can smell through it. And then there are some reagents. One is called isoamyl acetate, which is a really strong banana smell. And that's a pretty standard test for respirator fit testing. So,
and taste.
Yeah, taste, I don't know, but I know I've smelled it and it's extremely distinctive. It smells like sugary bananas. And so that could be something. There might be more of those kind of things out there, but that's actually kind of a good idea because I didn't know that the smell was so prevalent in younger kids. That's a cool idea.
I would think that the screener would be wearing a face shield in addition to like a cloth mask as well as some gloves. And in terms of the smell test, I agree it should be established, but one way is you could kind of spritz something and hand it to them, perhaps.
Idea.
But
Like
you're
the-
still passing something back and forth. So
Yeah.
Yeah, the PPE for the person administering is important for sure.
Mm-hmm.
So
I
I
know-
can look into what organizations have or whether there's anything standardized. I can check that out and email that out to people.
thank you. That would be great.
Sure.
So there is an app for our iPads and for our phones, quote unquote, that records all this information. And so I was on a webinar with it yesterday. Passed it on to our office staff to take a look at. And so basically, the app gives the standard questions. We can modify them how we like, and then the person administrating the test puts in the information in the app, and it completely reports the students' information as they go through the process. And so if they're not cleared, of course they're sent home, or they're isolated and then sent home, and they're recorded as not cleared. And so we can gather that information pretty quickly on an iPad as we're checking students in and doing those checks. And so that application is from our school, and I'll send out the link that I have for that again as a follow-up for this. It also does staff, of course, and our staff then would be self-regulating themselves in the mornings when they come in. They'd have to put in their temperature and, answer the questions and do that. And then I would get a report via the app by the time, 8:35 or whenever before school was, to make sure all staff have done that, follow up with them. And then also after they're entering the building in their staggered entries, then we would get a report on who's confirmed in and who has not been, and those kind of things as well. That application also is open to coaches, to drama program, to robotics, to all those programs. So as we move into that, now obviously those programs are not going to be in existence when we first start, but as we move into those things, it allows everyone who's in charge of those programs to see who's been cleared and who has not been cleared for that day, that specific day only. So I wanted to share that with everybody as well. It's about $400 for our size and what we need, and it seems like a really good application tool for us.
will it also do visitors as well?
You can add people as they come in through the day. The database is built on our staff, our students, because they will take it from our current database, our GradeLinks and our Schoology. And so we would have to physically add those people to test them as they go through as well.
Would visitors be allowed during the day?
Yeah, that's a good question. I know our office staff is not keen on that.
Yeah, I wouldn't be either.
Yeah.
What kind of visitors are usual, and are they, is it needed during this time? I mean, are these substitute teachers, or are these just, what kind of visitors are we talking about?
Parents would be one. Parents coming in to do drop-off things, things like that. I was thinking maybe we have an outdoor window where they could do that, right? And so that'd be the major flow in and out. Deliveries of different items, they would just be left at the door. I don't think delivery people need to come in the building, especially when we're in school, in a sense. And other, just your random visitors, appointments, things like that. But those would all be kind of closed down. That's my thinking, at least.
What about people that are newly enrolling or are interviewing for, the school year for admission?
Admissions for the following year too. Yeah, you're right. That would be one. Maybe the protocol would be, adding them to the thing. That's a good point.
Now that'll sneak up on us because that's like in October, November that kicks off, right? It's pretty early.
Yeah, you're right.
So it might be a good thing to add as a section to the doc, how we'll handle
Admissions.
and recruiting next year.
Yeah.
Symptom checks, is it enough to have just one station and one person? If you have, even with so you have half the school coming in and then 15 minutes later, the other half. Is that based on the last town hall? Is that kind of the plan currently?
Yeah, yeah. Actually, this morning we talked about spacing it out a little bit more to the numbers being a little bit less as they come in. But yeah, that's basically the premise of it. And having marks outside around our building patio area for 6 feet distancing and things like that for the lines. Again, let's all just remind ourselves that we're talking about a limited number of students as a whole. We're not talking about a whole bunch coming in, but yeah, there will be some staggered things there. We do have 2 entrances. If the group wants to look at having 2 locations for that, one entrance for juniors and seniors, one for, and stagger those times, we could do that as well. Just for safety purposes, that's okay.
Dave, do you have a couple of people that are going to be assigned to do the health checks at the beginning when they come in?
At this point, we've got the same people that are doing our health checks for our athletes downstairs. So they're already taking care of that on Monday through Friday when the athletes come in, and so they're slotted in to take over that role in the morning as we come through.
And I'm just making sure, I'm sure that they're not classroom teachers, right? Because they would already be in their classrooms getting ready for the day.
They are teachers, but they don't have the first period.
Oh, okay.
Yeah.
Okay. I'm just.
And I think
also,
one of the training pieces for all of our staff are going to be, I mean, all of us are going to have to kind of adhere to that training piece as well.
mm-hmm.
So do you have symptom check questions already developed within that app that they're using that you like, that you want put it into this kind of entry into building plan?
Yeah. Like I said, I'll share that app with everybody afterwards. But yeah, there's questions there we can take out and put in questions if we'd like as well. But yeah, the standard questions from the CDC are there as we go through the process for schools.
Another thing too is to think about is just privacy and HIPAA of a confirmed case. I know on our job sites, we don't record really, we have an attendance log for any visitors. And then if anybody's over 100 degrees, then we make note of it. But if they don't have symptoms or if they're not at 100 degrees or 99 or whatever, then it's not recorded. Thoughts on just privacy if everybody is being logged in an app? Is that or not?
Yeah, that's a great question. I'll ask the company. I think just what my understanding was that the report or the log is just kind of a data collection, mm-hmm. as we go through, so we can look back and say, yeah, they were clocked in and they were confirmed throughout this time. But yeah, I'll ask that question. That's a good one.
I don't know if we're getting to this level of detail yet, but just before I forget about the thought that of having 2 check entrances would also be good in terms of having maybe one entrance going into the first floor and then the other entrance using the other steps going to the second floor.
Is it possible to keep all of the students on either one floor or another, and that cohort using just that one entrance to enter and exit, and then just controlling the flow through that door based on times of the day? So that if you do have a positive case and the whole floor needs to be sent home or quarantined for 14 days or deep cleaned, that you don't have to do it for the entire building, that you can actually section it off.
Yeah, I'll put that to the schedule committee for sure.
And I don't know where this falls into the agenda, but just thinking about the lunchtime, I think you talked about this a little bit at the town hall, that the students would stay in the classrooms, in their homeroom classroom, or at least on their floor, to limit the mobility throughout the building.
Yeah. Using that lunchtime, the thought process that we had today when we discussed it was using that lunchtime as an advisory time and an eating time together. So the teacher would stay with the students, and they would have lunch and an advisory time, which would be both mental health checks for the students, could be actually task management stuff that happens for the students. How is this class going? What's going on? And kind of in a relationship builder in the smaller environment classroom, working out the details of that lunch and of like was mentioned earlier, switching the classroom switches and levels and floors are all part of that detailed process.
What about off-campus lunch? How frequently is that done? And I know it's different for different grades.
Yeah, in the past it was done for seniors every day, and then then we guided the other classes into that realm. At this point, and I'll take any feedback, but my initial thing is we can't do off-campus lunch.
I agree with you,
Yeah.
Dave.
Agreed.
Yeah.
Yeah.
I mean, it's just the exposure that then we're checking again as they come in,
Right.
the exposure that's political, that's out there for them. That's really difficult. Now, what can we bring in for lunch? That's something that we'll have to look at too, in the sense of the safety of it and the deliveries and things like that. But the off-campus piece, I think, just really has to be on hold for a while.
Yeah.
So on that number 5, entry into building, what if students forget masks? So masks, are there going to be standards for masks? I know there's a big variance in quality. Masks. That's a big deal everywhere.
Well, in that other document, I wrote in a little bit. I didn't write in the standards that they're applying, but I did put in the tight fitting part, no exhalation valves, and no bandanas.
Okay.
But I didn't put that in the other sections. And then the more I looked at it, other places actually had a little bit different description of the masks. I could incorporate that, but a couple of them are my pet peeves, is the exhalation valves and the bandanas, but that's a whole different story. But,
Yeah.
but I think we could probably put something together in whatever section that belongs in. We could put that in. So.
And standards would be readily available from state or CDC guidelines, right?
Yeah, they're pretty general.
Okay.
I mean, in terms of what I'm used to seeing for respirators and stuff, it's like 3 layers of cloth, tight fitting around the face kind of thing. So it's pretty general, but I think the other thing too is whether or not, you're going to allow face shields or not, because I mean, there's people going back and forth on that one too. So.
Well, the last I heard of face shields is that it just does not, it does not, it's nice to see the face and things, but it just does not have the coverage that a mask does, right?
Yeah, but if you read some of the guidance, and maybe if it's a month old, the guidance is already old, but some of them are saying face masks are okay. But like I said, they might be a month old and it's already out of date, so.
I think maybe the idea around that is that it's an accommodation. If people aren't medically able to wear the cloth face mask, then that gives another alternative. But then if you see some students wearing them and other students not, then that becomes, just gossip, I guess.
But I think, Dave, in terms of taking notes, like I definitely heard, hey, will the school have supply of suitable masks on hand if kids forget a mask that day, and just sort of making sure that that's available if the school's willing to do that. And then it's occurring to me, like, we probably want a section around enforcement. Like, maybe this is more for your staff. What's the teacher's responsibility? You know, if there are kids who are taking masks off during the day, you know, or is the expectation kids have masks on from the minute they enter to the minute they leave? Like, I just feel like there is a lot around the mask culture that you might want to help your teachers with, so that you can be consistent and, you know what to expect. Because I can imagine this being a challenging one with a bunch of teenagers starting to sort of, you know, flex their independence around this topic.
Yeah.
Agreed.
Yeah.
Good.
So one of the things is in that document that was sent out, that first page that was largely blank, were a couple of the areas that were on there that I thought at some point, whether it's this committee or Dave, your organization needs to look at. Communications and then the monitoring enforcement piece, like John said.
I see that now, Gary. Thanks.
Because I think one of the things that, I'll just be honest, I think we could have a really good plan that's going to address a lot of these things, but other parents, maybe more like me, I don't know who else might be as strange as I am, but I'm more interested in the school's dedication to the plan than the plan itself. You know, how organized you are, you know, how set up, you know, do you have someone assigned that's appropriate for doing, you know, the dirty work, I should say, kind of thing. That worries me more than the plan itself, because I think, I'm not gonna say any plan is good, but I'm positive, and I'm 100% positive after listening to this group today that we'll come up with a good plan. But I think for parents, at least for me, I wanna make sure that the system and the structures in place on your side to enforce it, just like John said. That's the more critical piece to me.
Right. I was actually talking to my son about this and asking him, did he think, you know, kids would try to take off masks during the day? And he said, yeah, just to be belligerent. You know, most kids, he said no. And he didn't name any names or anything, but he said, for sure, somebody would try to do it. And I agree with that, being a classroom teacher, although I teach much younger kids. I think they would have it for less belligerent reasons and more just, you know, they're flinging it across the room type of thing. But what is the, you know, what's the repercussion going to be for the first kid that decides, no, I'm really tired of wearing this, or I don't want to, or whatever it is. I'm in a bad mood and I'm going to take it out on my teacher. My son seemed to think it would be, you know, like a lot of peer pressure would help the situation. But also, I also think that the school needs to come down pretty hard on, you know, if you can't wear the masks, then you can't come to school.
Yeah, so I would agree, Gary, that I think that is, I mean, that's where implementation hits the road, right? This group putting together the plan and being that advisor piece for us, the parent group for us, putting kind of those expectations out there for us, and then as we return back with the teachers and myself, coming up with those consequences, if you will, coming up with those ideas and challenges. Now, Gary, you mentioned, you know, having the proper, well, no teacher is going to feel like they're the pro at putting on a PPE, right? And what does that look like? So yeah, we're going to need some guidance and help from this group as we go through it and work on it together as and put that out there. But I think if we can get the parents, families, students, everybody kind of on the same page with that honor, not the honor code, but the other document that was sent out, and have the students understand the impact of if we're branching out into this and we're able to pull this unique setting and have the connections together, then they have to do their part as well. And their part is the mask. Their part is being a part of that. And if not, then you know what? Then the online learning is your key. You know, what we heard in the spring from many families is, you know, the online learning was fantastic turnaround, but we want to be with our peer. We want to be with other kids. We want to do this. And so here's an opportunity in our unique setting for us as families and partnerships and all the things to set this forth, and then the students got to do their part as well, or they're just going to slide into the online category.
Mhm.
When I would add, when
I'm
I
gonna-
wrote into that, oh, I'm sorry.
Oh, I'm sorry. Can I just interrupt real quick? I'm going to have to sign off, but I really look forward to working with everybody on this, on such an important committee and getting the kids back in school. And I can't emphasize enough how important the masking and tight fitting masks. I see people all the time with the mask around the mouth, not covering the nose, loose fitting masks, various, variations. So the more we do from the very beginning to sort of eliminate that from being a problem, I think we'll get started on the right foot. And I'll sign off now, but I look forward to our next Zoom meeting and exchanging good emails on this issue.
Thank you so much, Lisa.
You bet.
All right, Gary, were you saying?
Yeah, no, it's okay. It'll come back to me.
So you're, sorry, Dave, you're suggesting to add like a pledge onto that COVID disclosure and release, like that we pledge to, follow those kind of mask rules. Is that what you're suggesting? Adding it to that? This is the waiver.
Well, I'll break in, and that document that was sent out, not very well organized. The last 2 pages were the Student and Family Community Responsibility Pledge, and that's kind of where we started that. And so this one is a little different. This one wasn't based on a lot of other examples. I kind of ad-libbed this one myself. So, and actually after I sent it out, I thought of a couple more we could add in there at some point, but that's where that one was. And then it sounds like, I don't know if we're going to try to combine that with a waiver or not. It seems like 2 different documents, but it probably can be done. It's just the other part is more lawyer part than this part. So.
Yeah, I'm sorry, I had forgotten about that. So that's fine. Yeah.
So.
And before I forget, so are you aware that King County is giving away free masks for community distribution?
Yeah.
So the
Yeah,
school
just-
could get thousands.
Yeah, just to address that, we did enter into a private school grant that was given to private schools for $10 million. Now, we don't get $10 million, but it's for all the private schools. And so they sent out a order form for masks, sanitizer, about a bunch of different things, shields, the whole 9. And so I just went down and checked all of our boxes. And so that, and I got a confirmation of that. And the next thing comes a quote, and then the next thing comes delivery of those things. So we do have that on the way, part of that grant for private schools.
Great.
That's great.
Yeah, that's awesome.
Back to the enforcement of the masks, if a student isn't wearing in the classroom, I could see maybe, because you want to work with the student, maybe they're just getting hot or not able to breathe. Not all of them are going to take advantage of the situation, but so maybe send them out in the hallway in like a taped box or something, on the floor, like where they can just kind of take a minute.
Mm-hmm.
I was reading was it the Concordia example, maybe, that's something that they did is give students breaks and allow them to step out of the classroom for more fresh air. So I don't know if that's probably not leaving the building. I don't know how you feel about that, having people in the hallway if there's nobody else in the hallway.
Yeah, that's a great suggestion. Yeah. And realizing that our classroom sizes versus classroom student count really work well. We've got 6 feet distancing throughout our square footage in our classrooms versus a classroom size of 15 students in those large classrooms or so. So yeah, there's spacing there outside in the hallway with markage. I wanted to mention that as well. The signage company I walked through with the signage company yesterday. And so they've walked through the whole building and are going to, I set the grant out for $1,000 to get our signage up and decals all over. So we could put a breathe decal or something to that effect, where you could stand and have that kind of an opportunity. So that's a great idea.
So maybe that could be the first is, okay, you get a 10-minute timeout or breather, and then second or kind of three strikes kind of a thing, where then they're sent home for a distance learning for a period of days, until they're ready to come back and wear their mask. What do you guys think about that kind of response and timelines?
Yeah, I think a progressive kind of slowly stepping up is the way to go. It's got to be both kind of educational, and then after that doesn't work, then it's got to have some teeth. But I think that is the way to go. And then we'll have to find out if there are some that are, and I don't know how you do this, but if they're medically not able to wear a mask for some reason, that's the other issue. So
Then the face shield comes into play.
yeah, probably, yeah.
Yeah. I mean, I like the idea. The thing that concerns me is that, they're in the hallway breathing
Right.
without a mask. So
Yeah.
I don't know. I err on the side of, I guess, safety rather than,
Yeah, they'd have to go outside and then checked again
oh,
when they come back in, I guess.
okay. Yeah, that would work too.
Well, if they're just on the patio, would they have to get a re-screen?
Oh, maybe not because they haven't left the grounds or anything.
Right.
So long as you have someone keeping an eye on them the whole time, which I'm sure there's
Yeah.
a lot of things to do during the day.
Yeah. Yeah. The patio might be an opportunity. When we had our patio principal on the patio on Tuesday, it actually was really good because the tables with the built-in tables right there, they're all like 8 feet apart. So one person per table was terrific, and so there's an opportunity there for something like that as well.
Well, the office has windows out onto the patio too. I mean, maybe they could be close to the office, so that there's not an extra person needed.
Right.
More work for the office. Sorry.
This
is incredibly difficult.
But the classrooms there as well have windows right out there too. So yeah, there's some visibility for sure.
So what about when they come into the building, then washing hands immediately? There was kind of talk on that in a few different documents, and not wanting to kind of bottleneck in the bathroom entry doors. Another thought is potential, I don't know how many of the classrooms have hand sinks.
Yeah, there are a few classrooms that have sinks. Yeah, hand sanitizers throughout the building, all the way through. We did that right away last spring. So that's a great resource as well. People can just zip by, and they're touchless or motion detected hand sanitizers as well. And of course, we ordered more through that grant, so we've got a bunch more coming.
Okay.
Does anybody know if the hand sanitizer is just as good? If after you get your screening, when you walk in the door, is hand sanitizer just as good as washing your hands? Or I don't really know.
Well, they say not, but then that's also assuming that people wash their hands correctly too.
Oh, right.
And so, I mean, it's fraught with a lot of, well, if everything is done right, then hand washing, they usually say is better. But
yeah.
I don't know, like even I don't wash my hands for 20 seconds and sing happy birthday and all that other stuff.
Right,
so,
right.
So the reason I put in there about the question mark between the bathroom part was the one part of the CELU building that's really tight are the bathrooms.
Mm-hmm.
And so, there's one way in, one way out. They're pretty small. And so to think that we're going to have kids go in and out of there didn't seem appropriate to me.
Yeah.
So, and
I
maybe
agree that, and our school was going to plan to just do the hand sanitizer at the beginning because, you think about how many students there are and 20 seconds each. It takes 15 minutes to get through a line of 20 kids, if they're keeping their social distance, et cetera, waiting their turn. And this was what a kindergarten teacher figured out for her class. And, it would still be not as long for the older kids because they're going to get down to their business right away. But I still think, gosh, that's a lot of time it takes to wash hands. And what Gary says, having all those kids waiting in line for
one in and one out of the bathroom. It seems like the squirt of hand sanitizer, unless they have a sink in the classroom they could go to right away, that might be okay.
Yeah. Well, and I think there was a note also of like school supplies, right? Bringing your own hand sanitizer as well.
Right.
Have that available as well. So,
Yeah. Yep.
okay.
Just really establishing a routine and having all of the teachers be on the same routine so that the students get kind of conditioned to just, okay, this is what we do. We come in, we do X, Y, Z, and then we sit down at our desks.
Yeah.
So,
Yeah.
all
Oh, go ahead.
doors, if at all possible, should just be propped open so that there's no,
Yep.
you guys are probably already doing that already.
Yeah. No hands on doors. Door.
Oh, you're not talking about building ventilation. Okay. Just in terms of touching the door. Okay.
Mm-hmm.
So, okay. So for interest of time, can we bump over to number 6 there with the responsive positive cases, that document and that kind of idea that went out there? At the point of you know, if there, as we're checking in, to start off with that piece, if there's a temperature glitch and you know, and then that student and or staff, but mainly students at this point, would be then isolated right away, sent, not even allowed in the building if possible, caught right away, and then sent home, basically. I mean, we're talking about somebody that we just need to go and get checked. I talked to a parent who works at different job sites, and they were able to come back once they showed a negative test from COVID, going in and getting the testing. So that's the thought process as we do the testing for, I don't recognize the smell, or my temperature, and those things, because the other questions are kind of like they answer them, right? But if those two things are popped, they're just instantly put aside, quote unquote, in a caring, loving way. But you know what I mean?
Yes.
And this might have changed, but I've also heard guidance suggesting 2 negative tests that are 24 hours apart.
Oh, okay.
But that's, I mean, it's definitely getting crazy.
Yes.
I could not figure that out. 24 hours. That did not make any sense to me. I mean, I would think 3 days or 7 days, but well, I guess it's a time issue for sure. But I don't know enough about the science, but that 24 hours seems, I don't know if Gary has seems suspect to me, but.
I'm wondering it's because some of these tests are like 90% accurate. I wonder if that's to make sure that at that point in time, they're negative, just so you're not relying on a false negative. But I don't know, that it just seems like if it's 2 days after and it's still negative, you should be fine. I don't know what the deal is. So.
Right.
Or maybe it's a minimum of 24 hours to make sure. But I'm not
minimum,
totally
I
sure.
think.
So. Yeah.
So yeah, I think if someone has a fever, the way that we do it at the job sites, if they're at 99, then their temperature is taken like an hour later, because sometimes if you are running into work or if you just ate or whatever, you could be slightly higher. If they're at 100, they're not admitted into the work area at all. So I don't know if you want to draw a hard line on that at entry and not admit them into the school, or if there's any situation where you would need to admit them into the school. I'm not sure.
Yeah.
I think that makes a lot of sense, because you've got some students that are walking maybe from a mile or two away. And so I'd hate to see them on a day they're running late, jog over and then have to send them home and go through all that. That at least gives them a chance to, okay,
Right.
maybe I have to wait for an hour. But if it's just because I ran to school because I was running late, I'd hate to see them get tagged into that. So,
Right.
but I don't know the other ramifications.
So my brother-in-law is a biologist, and he uses a variety of thermometers to take temperatures of critters in his biology lab. And he was just telling us on Sunday that there's a variety of efficacy of different brands of thermometers, and they ended up throwing a whole bunch of them out because they had a standard lamp or something that they knew the exact temperature of. And they found the one thermometer that was reliable. And I'll get the brand and the name from him. We might not have a choice about what we use if the people with the grant money are just sending us something, but perhaps we could just get 2 of the brand that we know is good, then that would suffice for at least a time being.
Mhm.
Do you guys want me to find out what that was, or do you think that's overkill?
No, to me, that's a really good point. That's, especially if he knows which ones are good and bad, that's
Yeah.
helpful, so.
Mhm.
And who knows if we can even get our hands on the good ones. I couldn't even get a thermometer for our house,
Yep.
but I'll ask him.
Great. We do have an isolation room. And back in the beginning of the school, it was a nurse's office, and so it's still there, and it's still going to work really well for an isolation room for students. So if we do decide as a group that running the school and that kind of stuff, they could sit in that room for a good 45 minutes and then be retested before the next round or whatever that looks like. We also discussed the late, because as we know, teenagers are never late. They're never late to come to school. So the late piece is just, it's going to be difficult for the students because they're just going to have to wait. We're not gonna do the, previously they'd come in the building, they'd go in the office, they'd sign in, we'd check them in and do that, send them to class, walk them to class, that kind of stuff. Now they're just going to either have to wait outside or wait kind of in our holding area until they can come and someone can come and check them, myself or someone else at that point. Hopefully that will help our tardiness issue for students that are late and just end up missing a whole bunch because they have to be even later. But we can't kind of alter from that, I don't think. And then if they're testing, then they're sent home if it's a positive result of the test or whatever that looks like.
Are you planning on having any honors classes or anything in kind of like a 0 period? Or is everybody truly going to be starting at the same time?
No, not at the same time. We're going to stagger.
Stagger, yeah.
Yeah. So,
Okay.
Honor classes will be incorporated into our daily routine, not earlier or later. The whole idea of flex day, moving that to Wednesday, moving that to be a little bit more structured, that's all being worked out as well. So our routine here as how we enter and what comes out, that will be structured for each day of the week as we process. Okay.
I just want to say you guys thought of a lot. This is great. Thank you.
Well, Gary did amazing reading through all that stuff. So what about somebody outside the building, family member, something like that? I think, we talked a little bit about the awareness issue, right? And letting people know. Of course, tracing is on all of our minds, and that's why the schedule is so important, to be able to trace groups and trace where students are. We do not have cameras in the hallways or cameras in the classroom at this point. I know some schools do have that. Some schools have put that in for tracing purposes, as well as other purposes, I guess. We do not have that. I don't know how. We have cameras in the entranceways to watch outside, but I could look into the cost of that if that seems to be something that is interested of this group for tracing purposes.
Dave, doesn't everybody have to be buzzed in the front door?
Yeah. Oh, yeah. Yeah. I'm speaking of like if we wanted to, if Mitchell, your son was, was COVID positive, then we could trace the last 2 days on the camera of who he came in contact with.
Oh, okay. I see what you mean.
Use the schedule as well as use the cameras if need be.
Okay.
I think it would be cheaper just to keep the kids in select areas.
Yeah.
Maybe,
Yeah.
just really kind of control where they're going. And then if something has to be shut down or people need to be notified that they might have come in contact, then I don't know. I think it'd be really challenging to even with the hallway cameras, but I could be wrong.
I agree. And normally the kids are going to know who they had contact with throughout the last, 24 or 48 hour. Well, maybe they might not remember it, but hopefully if the areas are controlled, then it will just be the people that were in their class.
For Mitchell and Evan, it'll always be the twins, right?
Yeah, exactly.
So you would just have basically a tracing kind of interview with that student after getting them off of the campus and sanitizing the area, right? You would ask them questions and just have a set list of questions that is recommended by Department of Health or CDC.
Right, exactly.
Dave, can I ask a question? And this may be premature, but have there been any parents that have said, I'm not going to send my kid no matter what you decide, I would just rather do online? And is that an option even to do that if the decision is to go into school?
I have not specifically, no parent has specifically told me that.
Okay.
As I send the link out, you'll notice that there are some parents that have, they're very concerned or, have feelings that way. And so, we want to make sure we're open line of communication altogether. And like I said, we are looking at 3 options for us. One is this one, which we're putting this together to be able to be in building and do what we do. 2 is this lack of a better term, hybrid kind of approach with numbers if we can't make the numbers that are the phases and what we need to do. And then 3rd is a complete online option. The families that do the complete online option, we're looking at, they agree to do that for a semester. And then we'll revisit that at the end of the semester. How are they feeling? What does that look like? And then the second semester, if they want to continue with that process, they will. And then at the end of the year, this was just talked about today. So this is what we're thinking through. At the end of the year, we again would reevaluate and say, hey, we're not necessarily an online school. We've done this for this period of time because we want to make sure that you continue to be a part of this community. But if online is really where you want to be, then we would help them find a source for them to do that.
Okay.
But that's our kind of longer than the short term. But for the year, my child has health issues. My child has. No one said this, but I'm just making this up. That someone would come and say, hey, I'm really not with this. Can we still be part of the community? Can we still get this stuff? But they need to go online. We don't have the staff to make both of those or all 3 of those options happen.
Right.
We can build that online thing, but then that's the commitment that you have for the first semester. I mean, we're not going to go back and forth if that's
right.
what you need as a family, which we totally respect.
So Dave, one question. So say one of the kids gets tested positive, so they're out for 2 or 3 weeks. Will they be able to be online as well?
They will be able to use the tools that we used in spring, as well as we're looking at streaming some classes.
Okay.
So okay. They'll be able to use those tools to stay connected and to stay work. One of our hybrid models, meaning if we're forced to go home for 2 weeks or whatever that is using that streaming piece. So that student then would be put into that category for that period of time, okay. And then back in.
Because I think that'll be helpful for keeping us all honest about, well, they're not going to miss school if they say they've got it, and they might be asymptomatic, but maybe for some reason they got tested and they got it and they can't be in school. I mean, that to me seems to make it helpful that they'll stay out of school and keep everybody else safer that way. So
exactly, yeah.
Yeah.
Well, and in particular, if there's contact tracing, so even if other kids aren't, haven't been tested, aren't they going to be in quarantine if there's contact tracing? So that could be several students just for one positive test.
Right.
So could be out for 2 weeks.
Mm-hmm.
So that being said brings another question. The testing piece, right? I'm talking to Franciscan Clinic right down here across from Les Schwab. And because we do physicals for athletics with them, We have kind of a relationship where students can go in, especially international students can go in, pay their $5 and get their physical, right? And so what about the testing piece? So let's say we have the contact tracing. Let's say Mitchell has positive for COVID. He needs to be home, take care of himself, get things. But then Evan and the twins are his contact tracing. So can Evan and the twins go get tested within 2 tests within 24 hours and then come back?
There's an incubation period, right?
Yeah, there is.
Yeah, it depends on when they got exposed and all that. But yeah, usually I think they, in accordance with some of the guidance I saw, is if they were exposed to someone with it, they still need to stay out 14 days, was my understanding.
Okay. I thought
Yeah,
it went to 10, but
Sorry.
I'll check the 14 to 10. Yeah.
Yeah.
Yeah. That's a good question, though.
Yeah, I mean, definitely.
And so kind of for those reasons, I was wondering if it was possible for all of the classes to just be recorded and then posted to Schoology or whatever, even if it was like a day late.
Mm-hmm.
You know, I don't know, with your
I think that-
streaming.
I think, Lisa, you got a point. I mean, I think it's just going to be not an if somebody gets it, it's going to be a when somebody gets it, because even with a small school with as many teachers and parents and people that we are exposed to at home, and if they work and all that thing, somebody's going to get it. You know, it's just a numbers game. So then we have to make sure that when they get it, if and when they get it, they are able to keep up with distance learning as long as they're healthy enough to do so at home. So recording each lesson on Schoology or some, online platform will ensure that they don't get behind, and all their people that they've had contact with as well.
Yeah.
Similarly too, if a teacher needed to quarantine themselves, then they would still be set up to be able to maybe record a demo, and it could be, I don't know, streamed in class or something.
Yeah.
I don't know.
Good. That's good. Yeah. Our YouTube channel would be a good use of that.
Mhm.
Yeah. Mm-hmm.
So who at the school would be doing the contact tracing? I've found that it's within our organization, it's really useful to have one or two. So on every job site, we have a COVID supervisor who's responsible for making sure that all the PPP is being worn properly, people are being distanced. They're the ones that are kind of walking around and doing kind of the reminders and the enforcements. And then we have, in our office, myself and the project managers, more of the experts on kind of what to do in certain scenarios. And then we have our president that can make kind of the tougher, kind of buck ends here decisions. So I would assume that you have your teacher layer that's kind of like, hey, put your mask back on, kind of a thing, and why don't you take a breather on the patio. But then in the event that a positive case, someone is exhibiting symptoms, then the teacher should have some place to send that student, right, to kind of go to the next layer.
Is that the health room?
Yeah, that would be the health room, and then the administration would take over.
Okay, so someone in the administration would be doing the contact tracing and contacting parents and.
Yeah, exactly. Because we'd have a good idea of the schedule. We'd have a good idea of the group that they were with and what that looks like. And using our grade links system would be pretty easy for us to do.
What's the current, or I know there are different types of COVID tests, but would there be a standard, like you said, or would there be a standard place we would send somebody? Because there's going to be colds, there's going to be not COVID symptoms. So it would be, results of a test are, quick. So maybe I missed it, but so is there like a standard place that we would send students so that we know that we don't have to wait 4 days for a result?
That would be good.
I think it's good to have a separation, like legal risk for the school, maybe, and just advise that they call their healthcare provider and have them get their advice from their healthcare provider of where to go. But I do know there's a testing facility down near Soto.
Yeah.
You can just kind of
You know
drive
where
up
the
to.
DMV was, you just go through in your car and you get swabbed, but you have to make an appointment.
And that has to come from a doctor's recommendation
No.
that you make an appointment? No.
You don't need a doctor's recommendation. You can just go online and make one yourself.
And then what happens to the people while a person who exhibited symptoms, what happens to the people they've been in contact with for the few days that they are waiting for results?
That's a good question.
Mm-hmm.
I guess just no symptom. I mean, I'm not a doc, but I don't, gosh, anyway.
Yeah, because it does take 2 to 3 days to get the results because there's so many people being tested now.
Yeah, that's why if they are positive or have a 100.4 degree fever or whatever, they just shouldn't even come into the school,
Right.
or the isolation room, and they should stay outside. But if you discover that they're exhibiting symptoms and you want them to take a test after they've been in contact with all the other students, I'm pretty sure there's guidelines out there. It might be that you notify everyone that we might have had a positive case and they're currently taking a test, or you send everybody home until you get the test results.
Well, in the document that was produced, that one, I think that section came right out of, I think it was the UW's documents. And so what they say, and to their benefit, they have people that could do this, but they do a risk assessment after they do their tracing. And then they decide whether or not people need to be sent home, whether they need to quarantine and all that. And so I don't know if we have a contact at like the Public Health King County or something like that, but if we go through that, I don't think it was hard and fast that everybody that was like in the same building with them have to go home, but also someone's going to have to make that judgment on what was a real exposure, how much time, space. If we did everything perfectly, people were 6 feet apart and wearing masks, does that mean everybody in that room have to go home, or is it okay? There's a lot of nuances to that they have the professional people to do that, and I don't know if we have access to like the health department or something. Like if we did, I would probably say stick with the language that's in there because it gives you the flexibility. But otherwise, I could probably look for other language that's more hard and fast. But then at that point, you're stuck with that hard and fast kind of, okay, if this happens, this is what you do kind of thing. So
Yeah.
I think this response plan definitely needs to be flexible, and it will change as more information is known and more external pressures exist.
Yeah.
I think it's good to have, like Gary was saying too, try to find someone that can come from the outside and give us assess the situation and guide the decision-making process. Because I think there's so many factors that get wrapped up into the process that, if we had somebody from King County or a medical or somebody that can come in and say, okay, from our classroom observation, from our teacher observation, it was a large classroom with 10 students in it. Everybody was at their desks. Everybody was doing their things. So, they're okay. Or, they were doing a science lab and they're all together doing the thing. And it's like, oh no, they're all going home. Right. I think that would be really good to look into. I don't know anybody off the top of my head, but I'm sure I'll think on that and see if maybe this group has somebody too.
And maybe if there's not, maybe at the minimum, there's just a number, a consulting number that you can call with all of the information, and they can kind of help guide the administration through each of those cases.
Yeah.
Because with everything going on, they're probably not going to be sending people out, but.
Yeah.
Right.
Right. Yeah. Much like we have for lack of better terms, the CPS and things like that as well, right?
Mm-hmm.
Okay. All right, so we went through the waivers piece and kind of talked about those two documents that could be blended. What do we think about blending those, or should we continue to have the waiver and the honor code kind of thing?
I liked having both, but I also wanted to make sure that along with the student signature and a parent signature, I don't know if you can see this document that I'm holding up. I think this was the response to suspected case. Oh no, is that right? I can't remember which one. My pages are out of order, but this one where you had the student sign and the parent sign, and then if there is another parent in the house, I think everybody who lives in that family should sign this document. And whether, you know, it's a parent or a caretaker, grandma or whatever, they're part of the part of the team to keep us all safe.
Yeah, that was part of that community responsibility pledge. So no, that's a good point. So maybe just an explanation and some more lines.
Yeah.
Everybody in the household has to sign it.
Yeah. And maybe siblings too, I don't know. I mean, because it's going to rely on the safety of the herd.
Yeah.
Yeah, I don't know if I see an 8-year-old understanding what they're signing, or, you know,
No, maybe not, but.
Or at least adult siblings.
Sorry?
Or maybe adult siblings, because there might
Right.
be 19 and 20-year-olds. And actually, that's probably the audience we need to get. So
Exactly. They're the ones that are spiking now.
Yeah.
All right. Thank you. The communications piece, that was part of that very first one where we kind of had the blank page. The content, tone of messaging, frequency, platform, and who to send it to, that kind of goes with the tracing pieces as well, I think, as well as the initial document, you know, in a week or two, once we're done with it, as it goes out to our families, to let them know that this is what the team has come up with, and going through that. I'm more than happy to start that process, but I definitely would need some editing and help from the team on that. So, and then other communications can kind of fall into that. So I'm not sure what else we need to do on the communication piece.
I saw in one of the documents it said text blasts as an option. I don't know if that was just kind of stood out to me because I had never had a text blast before. So other than spam, but yeah, I don't know if that was something that you could utilize or have set up within a certain system. I don't know if that app could also do like,
oh yeah,
sort of like safety violations, or if the app could know, you know, like you could kind of track the number of times that a student didn't wear their masks. So if a different teacher had them, then they would just know automatically where they're at.
That's a good idea.
Yeah.
But also you could have a certain group of, you know, that needs to be communicated to, like their cohort or one of their block classes or whatever.
Yeah. Yeah. Each in our grade links for our in-house communication, each class is placed in there. So, for example, if we had a first period class and we dictated this, and it was from 9 o'clock to 10 o'clock basically, and then we found out the kid was sent home at 9:45, we know that group can be emailed right away and or messaged right away for that purposes. So that's kind of built into our system. But I do like the text thing, kind of like school closures or lockdowns or things of that nature, where we want to make sure parents aren't panicking, but that people are informed.
Right.
Yeah.
More emergency communication.
Yeah.
And I think the other part too, all that is critical, but the one thing during the first few months of this that were really good are your updates. And so, you know, if you could continue to do those, maybe with a focus on what went really well with the being in school kind of thing, and play on that might be helpful too, because I think that those, at least for me, I shouldn't speak for everybody, those are really helpful to see what's going on with the school and all that. So, I mean, I thought they were good. So
Yeah.
more work for you, Dave.
Oh no, it's one of the things that is just kind of very clear, like just on Tuesday for the principal in the patio thing too. I mean, everybody processes and hears the information differently too, right? And so the more that we can do things virtually, the more that we can do things and communicate in different ways, so people get the information. That's key. And you all know me, I love to talk, so it's not horrible for me. So I appreciate that. All right. We talked a little bit about monitoring and enforcement. I think this team comes up with some guidelines as that goes, and then as the teachers return and as we have discussions on this, I think it's kind of come apparent that the teachers are going to be the ground floor, and then administration, of course, is going to check in just like we would with any other situation of discipline in the school, right? We want the students to be the ones that respect it, understand why we're doing it, health and safety of everybody. Teachers enforce it, give them that timeout, have the things. If students are belligerently still not doing that, and not because they're sick or not because they have other things going on, but they're just playing around, then it's time for them to go have some time away from the school. And I think, one of the things, and I can't speak for all the students, but most of the students that I talk to, that's not going to be a positive thing for them. That whole shift of, which I've really enjoyed in 9 years here, that shift of, I want to get out of here, suspend me, get me out of here, has shifted and especially with last year's, having to go home. At first, students were like, oh, okay, all right, cool, this is going to be great. And then spring break came and they're like, oh, we're not going back. And then it was like, oh, this is, and then I heard from at least my son, I want to go back to school. This is not what I want. And so I think that taste we can play as a, like, this is recent memory. So if you're not going to stay with what we're trying to do to keep everybody safe and to stay in this mode, then you just can't be here. It's not that we don't love you. You just can't be here. You're not ready for that kind of opportunity. And hopefully 3-4 days at home, they'll understand that this is something that they want to conform to. It's hard because at home, sometimes they're getting different messages as well. Right. It's so diverse, like I said, the other night, and we went from 6:30 to about 8:45, and it was terrific conversation about this and this plan and what we're doing, but also about how are we as a school going to approach it, all these different ideas and thoughts with our students, right? Much like our approach to religion and our approach to religion and the Christian curriculum that we're sharing. So I think we just got to buy into the students buying in. I'll end it. So. All right. Then it looks like we kind of have a list here. Thank you again, Lisa. And I think we hit most of the things on the list there. I would like to ask Wendy to share a little bit about her meeting. You said you had some things to share.
Sure. So it was the Washington Education Association with the Seattle Education Seattle Education Association. That's our union people on it. Just, really basically bringing forward some more statistics, updated statistics. And, we're in a very different ball of wax or some can of wax or can of worms or whatever you want to call it, in that all of our schools are much, much larger than Seattle Lutheran, and social distancing would be impossible, especially with the young kids. So I'm really interested in what Hope is going to do, but I think with older kids who are more capable of being responsible and following these regulations and knowing the importance of it to their family and the world, and also following that. But I think that, let me see, I'm trying to remember where I wrote stuff down, but they were just talking about, and what I really worry about too is the exposure to any teachers or any people that are at high risk on your staff as a whole. That really talking about educators that were ready to just say, I can't do this year because of those reasons, if they had to go back into school. I don't know if they're, and I don't want to get into personal, details about anybody's health history, Dave, but if there are any teachers on your staff that are feeling like they can't do this or they can't do this safely, I really want to respect their concerns and what we can do to really keep them safe. So that was one of the topics of discussion. And I think they were also, another topic of discussion was what to do with substitutes. And if somebody does fall ill on a staff member, for instance, what do we do about creating the class to continue even though the staff member is not there? And I think we have to assume that if the staff member is not there, they are not going to be able to lead a Zoom class from home, because the people that I know that have tested positive for COVID have really felt horrible and not up to teaching at all. So what do we do in that scenario? That was one of the things brought forth. And just, the general, the cleaning of the schools, how would that be done effectively? And moving forward, when we do go back, whose responsibility is it to keep the schools clean besides, just the custodian? And other people were asking, okay, let's say we have to send the students home. If we go back to stay home, stay safe orders from the governor, then would teachers be allowed to come into the buildings if they wanted to still use their classroom instead of their noisy home or something like that, because they had other kids at home or everybody was vying for the computer at the same time? So those were some issues that they brought up that I thought would be good issues for us to also think about.
Yeah, those are great. Yeah.
Yeah, thanks, Wendy.
Mhm.
So the cleaning of the schools, so Glenn is looking at some bids. Those I assume all have, COVID standards for cleaning. And then one of the questions from the last town hall was about the building ventilation.
Yeah. The research that I've done on that is we have no ventilation in our building, so we don't have to worry about it. What I mean by that is each room has its own blower from the boiler. So it's an old system that actually helps us because as we test those blowers, each one individually, it's not a system that goes throughout the whole building. So when we have the company come out and look at some different things, we have them test those blowers. And if there's a blower that has a problem, then that filter and that stuff will go through, but we don't have to blanket do the whole building because each one of our buildings is in the summertime ventilated through the windows and in the wintertime through a boiler, with each individual classroom having its own system.
Does each individual classroom have opening windows?
Yes.
Oh, that's nice.
Yeah, I tell you, the more I've been harping about how much I don't like this building in the last 7 years, the more this last year I'm like, wow, this building's pretty rock solid, man. It's got huge classrooms and windows in every single one. And oh, don't complain about the heat. We don't have any internal system that we have to worry about. So, or air conditioning, right? So, hey, there we go.
Right.
So your blowers, so all the blowers are doing, is it like a radiator thing? So where the furnace is just heating up water or something, and then it's blown out from that particular spot?
Yeah.
Okay.
And each room has its own. So I can get my room really, really hot, or I can turn it off and get it really, really cold. And so what happens is in the wintertime, we have students that rooms are nice temperatures, and then they get so hot they turn down, and then by 3 o'clock they're like kind of cool again, and I will come in on a Sunday evening on a really cold winter spell. I'll come in on a Sunday evening and I'll turn all the heaters on in the classrooms and open up all the doors. So the heat will come and blow through the hallway because there's nothing in the hallway that heats or cools. It's just from the classrooms. So.
And what about the janitorial contract bids out and COVID certifications on cleaning?
Yep. Glenn's into that right now. He's got three, I don't know if he has got them in hand, but he's had 3 companies give bids. Board has already increased the budget tremendously for cleaning, what that looks like. So I think Glenn's email explained as well that the building's been dormant now for 3-4 months. So we don't have an issue of COVID in the building. But we do want to clean it, and we do want to get some organization behind getting that done the 1st and 2nd week of August, just so we can kind of start fresh and start new. And that's a good energy, I think, for all of us to kind of think about how we can help with that. And then after that, normally our contract with janitorial starts on the 15th of August. So they'll come in, they'll do daily cleanings and a deep clean on whatever. Right now, Wednesday is that flex day. So a deep clean, meaning shampoo, carpets, the whole thing. So
I remember in kindergarten, we used to have, sanitizing wipes as one of the, class supply list. I don't know if you want kids to, to supply that for the class and they wipe down the table after they're done, I don't know. That may be overkill, but.
No, it's not at all.
It would be great, but you can't find them at any store.
I know.
I have for months, and I can't even find one container.
Yeah.
We get a little bit of luck at Costco.
Yeah,
Costco has them?
Yeah.
Oh, okay.
I
Spray,
think-
Lysol spray you can't find. But the wipes I've seen around.
Yeah.
Okay.
And I think that's perfectly good for Dave. You expect the students to do that because even back in middle school, all those Explorer West kids, they had to clean the building, once a week to wipe doorknobs and wipe desks and stuff for different areas. So
I love it. I honestly think it's an implementation we can do now that will last long after COVID, because it's ownership.
Yeah.
It's ownership. It's remember the days when you have to put your chair up, and all that kind of stuff. These kids, and I love them all. I love them all. But they walk in and out like, hey. It's like, whoa, hold on. They can't, right? And so now we have this is protecting you too. So it's kind of that selfish mentality that says, okay, yeah, I got to clean this up for myself. But then I'm really helping the community as well. So yeah, I'm all 100% behind that, having students wipe things down before they start and after they're done.
Can we provide them with gloves?
That's on the PP, that's on the grant list. Yeah.
Okay, perfect.
So we'll get some from that. So, all right.
Okay.
So Dave, do you want me to take a shot at it? So the one question that we didn't talk about as much as I think Lisa might have mentioned, having a COVID supervisor. Are you going to have someone kind of in charge of that overall effort? I mean, I know you are, but then whether or not like Glenn or someone's going to be in charge of, coordinating the rest of this stuff, or because I could take a shot at how you're going to organize some of this stuff, but I just curious how you're going to do it. So
yeah. So we're I'm talking with Glenn right now. Actually, the WIAA came out and the athletics and activities have all been pushed to January across the state. And so he and I are going to have a discussion on what our response is for that, as well as, what kind of roles can we take on here in the fall. So why don't you let me have a discussion with him first before I definitely say yes in that. But that's where I'm leaning. I think with the size of our I always say our unique size, with that, and with the roles that we can take on, I think we can do this and do it in a fashion that's pretty prompt and pretty swift when need be, because we're not dealing with 200 kids, we're not dealing with 300 kids, so and families. But before I confirm that, let me have a discussion with him as well.
I know your flex day had initially you were thinking Friday, and then you switched that to Wednesday, kind of as more conversations happened. In the some of the initial conversations, you're talking about having all the students just stay in that one classroom and have the teachers move. Is that feasible still with the block and the period scheduling?
Yeah, actually, we talked about that this morning as well. So it looks like we're shifting a little bit towards more blocks than periods, just because of kind of the equality of classroom time that we need in our classrooms. And in the positive light of that, it looks like there are some courses where students do not intermingle. So for example, your English 11, your English 12, your English 9, and some of your, but some classes intermingle a lot, your maths, your foreign language. So we're trying to work our schedule so those specific days are listed on those, there are specific days where there's going to be intermingling that we have to be careful of, and there's specific days where they're just going to be in one class, basically, as they go through. So that's part of the scheduling that's really working well with the COVID. That also helps kind of Wendy's comment a little bit about teachers, right? Because the apprehension that teachers might have, and if we say to them, well, hey, on Tuesday and Thursday, you have to be here in the morning for your blocks and this, but on Monday you don't have to come in, or on Monday you don't have to come in till 1 o'clock. They're out of the building, so they're out of the danger zone, quote unquote, and it's okay because their classes are meeting at different times, right? So those are scheduling things that will work that way. So the flex time is the one that's still kind of, we're working out the detail, hearing from the town hall how we want to put more structure to that, which I agree with wholeheartedly. And so, but yeah, that's kind of the idea with our scheduling in our classes for that purpose.
So how many days, or which about percentage of the time would students be moving from one class to another?
The
classroom physically.
Yeah, you mean passing times, right?
No, I mean, are they, I guess I'm still unclear if a student is going to be in just one room for the entire school year, or if they're going to need to move from one room to another room during the day or from day to day, because that kind of knowing how students are going to flow might change how you approach your cleaning in between students being and occupying certain areas.
I gotcha.
Yeah.
I think the schedule will best explain that. So let me we'll finalize that piece, and then we can talk about that, because I think having that schedule in front would allow some good explanation to that.
Right. Cool.
The other thing that we haven't talked about yet is PE. And all the, I just can't imagine PE happening with masks on and socially distant, and maybe Glenn's got or Mr. Burrs has a, take on what they can do that is PE like, but not, sweaty people breathing on each other.
Yeah, it's completely switched to fitness. It's not PE.
Okay.
So for example, right now they're doing, athletes are coming in, or any student actually can come in, sign up on the Sign Up Genius and come in and work out for an hour, be tested, in the whole nine, the protocol. They have a mask on. They're either in the weight room or in the gym. If they're going to shoot baskets, they bring their own basketball. If they, the bathrooms are closed, right now, because we're in phase 2, that's kind of the limitations that we have. But it's not, we just have to take away the idea that PE is dodgeball and we're going to learn this sport and do this. It's fitness. It's going to be the idea that you are working out in your 6-foot area. You have your mask. If there's no one around you in the whole gym, then you can, probably work out without your mask, but that's about it. I mean, it's going to be that. And then secondly, as things open up, there's a row place right down the street I saw was open yesterday, and they're taking 5 to 6 people in. And so talking to them about having our students go down there and just work out with them, and work with them on those kind of fitness pieces. So it's not the old days of ball bouncing back and forth and all that stuff, which I agree. I think it's better to have fitness, and our class size allows for that too, especially with our gym size. So, but yeah,
Okay.
there's gonna be some different things for it for sure.
Okay.
All right. Well, thank you, everybody. I think we had some people taking notes, and I really appreciate that, because we can make some recommendations from those. Gary, I think that would be great if you could take another revamp after some of the notes that come across. I will send out the links that I have via the survey and the Our School app for everybody to take a look at. And then first part of next week, I'll send out another notification for another gathering if we don't mind that. So
Oh, that's great.
So what I'll do is for what notes I took, I don't think I took really great notes. I'll adjust the documents that I took notes on and send them out, and people, anything I missed or any other comments you may have, you could either do the comment thing in Word, or you could track changes, or however you guys want to do it. And then I'll start putting them together. And if I get conflicting ones, what I usually did, like in my job, is I'll put them both in there and we can talk about it and work through it. So do it that way.
Good idea.
Thank you so much, Gary, and David and everyone, but thank you very much.
Yes, yes. Thank you.
thank you, Lisa, for helping out with the agenda too. Appreciate it.
Sure.
A lot of work.
Well, I think it's worth it, though. I do. I still am holding on to the plan that we are in, and we're going to take all precautions for it. I do understand that might not happen. I get that. I'm just an eternal optimist that way. But I also know that the work that we're doing right here, right now, is going to help us no matter what. So I think we have to kind of keep that in mind as well, because we're talking about the kids that we love. So it's time to show everybody, the families, that we have a plan and we're ready to kind of move forward. So thanks everybody.
Thank
Okay.
you.
All right.
you.
Touch. Thanks.
Good night.
Bye-bye.